Open Action News this morning on TV 20 Detroit.
Flu season is officially here, and one doctor wants to make sure you know the symptoms so you can get the right diagnosis. Coming up, they're going to join us live in studio with the signs that you need to know. Plus, knowing your symptoms can help you determine if you actually do have the flu. After the break, a doctor joins us live in studio with some important signs you need to look out for. Stay with us. You're watching 7 Action News this morning on TV 20 Detroit. Welcome back. 8:11 is the time now, and just because we're entering flu season, those flu-like symptoms you're experiencing might not actually be from the flu. It could be from something else, and that's why knowing the signs and symptoms could save you time and money and reduce your road to recovery, which is so important. So to help us out this morning, we're so excited to have Dr. Ken Redcross, a board-certified internal medicine physician and founder of Redcross Concierge. Good morning.
Thank you,
Welcome
Anne-Marie.
to Detroit,
It's wonderful to be here with you again.
All right. The flu, just even thinking about getting the flu kind of makes us feel achy inside.
Yeah.
How do we know when we have the flu, and what do we do?
You know, it's a great question. The big point about today is I want everyone out there to be virus vigilant. I want us to really be on top of this thing. I think at this point, we're all a little familiar with the flu, right? Fevers, chills, but it's those body aches, Anne-Marie, when we know this is probably a little bit more than a cold at this point. But the key is that you want to get into your doctor's office as soon as you can.
Okay.
The reason why I say that is because we know within the first 48 hours, you come to our office, we can write a prescription that can make a little bit of a difference. But lots of times we don't know whether we have the flu or the actual common cold. But at least there is a homeopathic ingredient out there called oscillococcinum. See, oscillococcinum has been shown to decrease the severity and the duration of flu-like symptoms. And not only that, oscillococcinum has shown in studies 60% of us can feel better within 48 hours when we take it. I have vitamin D here as well because there were some studies that showed that if you're deficient in vitamin D, that can make you more susceptible to the flu as well. But once again, when you're talking about these viruses this time of year, you need to think of a couple of other ones too. One of them is the norovirus. That is the one that affects the cruise ships and the daycare centers.
Yes.
And it's tough because it usually for 48 to 72 hours, a lot of nausea, vomiting, and diarrhea. So it's no fun. But once again, got to make sure your hands are washed and make sure you stay hydrated.
Virus vigilant. I love this.
Yes, important. And the other one here I wanted to highlight is Coxsackie virus. That's the one that causes hand, foot, and mouth disease. We typically see that in kids under the age of 10, but we had an outbreak in Florida State University, so it was important to recognize that. Now, the thing that unites all of these, Anne-Marie, is the fact that they all can present with fever.